Hello everyone, how are you all doing? And a very warm welcome to all of you in our today's video. Today we'll be talking about specially about auricular therapy. What is auricular therapy? Okay, auricular therapy. Auricular therapy is kind of acupressure only. Okay, it is a type of acupressure or kind of acupressure we can say. Like in acupressure, generally what happens, like whenever we press some points, we stimulate some points on our whole body, then we relieve pain of a person, or we give treatment to a person of some problem, right? Whereas similarly in Suzok therapy, whenever we treat whole body problems points on hands and legs, right? Similarly in auricular therapy, we treat whole body problems only on our ear, only on the ears. We will treat full body problems. Okay, any kind of problem you are having in anywhere in your body, we'll do it on the ear, we'll treat it on the ear. So auricular therapy is my favorite, my personal favorite. Okay, it is very special to me, it is very dearer to me. Okay, as in auricular therapy, I have seen results like it gives results same as acupuncture. Okay, it gives results more than any other therapy. If you are doing in acupressure, if you are going in suzogi, if you are going in reflexology or any other therapy, more than it or faster than it, you will get results in auricular therapy. Basically, I'll share my experience with you all. Like when I was when I started, okay, just I have learned this therapy. I just recently learned it, okay, and I had joined one trust. Like I was giving therapies. That trust, they had a clinic, and I was treating people over there. Okay, so I had like one student of mine. She was like saying like one of my friend is having a problem of trigger finger, and is there any treatment in acupressure, suzok, or auricular, whatever you are doing in that? I said you can just send her to the clinic. I'll just check and let you know about it. Okay. So when she came to our clinic, I was like, please let me know more about it, because I wasn't knowing what is trigger finger actually. So the trigger finger is the problem where your finger gets stuck or your thumb gets stuck like this, and you are not able to open it. Like it won't come, like it won't come up on its own. You need to go and like open it with your another hand, and it is really very painful. It is unbearable pain is there, while like whenever you are trying to open it up, you will feel unbearable pain. Okay, so I got that patient. She was like, I don't know like what exactly the allopathic doctors have said, what treatment they have given, or what they are saying. Okay, then she said there is no medicinal treatment in this, or if if I want, I can do my treatment where like I can go for operation, in which like 1-2 lakhs rupees will be used, or I can go with what we can say, or I can go with steroids, taking steroids, 3-4 injections of steroids I need to take, and one injection will be around 16,000. I'm like, okay, so what do so I asked them like what exactly you want to do? You want to go with operation, or you want to do steroids? What exactly you want to do? So she said, I don't want to go with both. I want to go with some natural treatment, natural things, and something. So I am here to ask you. Okay, she was like that. I was like, fine. See, I told her like clearly, I haven't heard about any person clearing trigger finger with auricular. I haven't known about it. And secondly, this is my first patient who is having this problem. I have done treatments of acidity, gas, and other things, but this is my first patient who is having problem of trigger finger. Okay, I am treating it first time. I just told her clearly about all these things. So she said like, what should I expect from you then? Okay, she was asking like that. So I said her, give me 2-3 months, give me to I said her, give me 5-6 months, and you will see the results slowly. Okay, but as in we are not giving you any kind of medicines to give a faster result, but while doing this treatment, first be assured that there will be no side effect. Secondly, you do not worry, you will get faster results, but it will take time. Okay, do remember that. Without any medicines, without any operation, you will get result, but it will take time. So I had asked her for 5-6 months. I told her like 5-6 months, you need to be a bit patient and like that. Okay. So for first time, I had just applied auricular points for her on her ears. Okay, like I have gone with the auricular 7 point formula, 7 step formula. I had written all that things, and I had just given her treatment with that. So on the I had not given her any kind of Suzoc points. Like on trigger fingers, we have three main Suzoc points which will help. But I said, no, first I'll just get to know, like in my mind, like what exactly auricular is giving you results. According to that, we will then add on Suzoc points. Okay. So as why? Because Suzoc in Suzoc we have hand points. All patients, what they can do is like once they have come, they know the hand point. The second day also, if you do same treatment, the third day the patient will not come only. Why? Because it is giving me same results. Like same point you are pressing, same point you are applying magnets. Why don't I do it on my own? Why will I come towards you? I'll do it on my own then. Right? They will say you like that. So what I have done, I had said like we'll go with auricular only, and then we'll just start with Suzoc therapy. Okay. So in auricular, there is one benefit is that you do not need to ask the patient to come towards you daily. Okay, as these are the seeds of auricular. These are the seeds. These are called as Vaccaria seeds of auricular. Okay, like we do treatment of auricular with these seeds. You can also do needling in that, but I prefer these seeds. Okay. So this sticking of this tape is very good. The seeds do not get out or do not come out in 1 or 2 days. They stay with them for 1 week properly. Okay, so what I told her, like apply it for 1 week, then on the next week, whenever you come, like today is Wednesday, next Wednesday, if you're coming, then we'll see the results. Also, we'll get to know what exactly your body is, how it is accepting this therapy. Okay, like that. So on the first week when she came, she said like there is 80% result. I'm not feeling any kind of pain now. Yeah, my fingers is getting triggered, but I'm not feeling any kind of pain. Okay, my finger is getting stuck, my thumb is getting stuck, but I'm not feeling any kind of pain now. Okay. Then, like we continued the treatment, we have given her this treatment. Then we had taken also Suzoc points in it. Then we had given her treatment for like I had asked her for 4 or 5 months, right? But the after 2 months, she was like, I do not need anything now. I am totally fine. I'll stop this treatment also now because I think I do not have any kind of pain. My body is fine now. Everything is fine. I'm not feeling triggers now. And it's been now 2 years, okay? She has not feel any kind of same problem again in her life. Okay? Auricular therapy is that best. It gives result as acupuncture. It gives the same result. Secondly, in auricular therapy, you do not need to invest the time on a patient like a 45-minute session, a 50-minute session. No. On the first day, whenever you like on the first session, yeah, you need around 30 minutes time so that you can write down the notes or what the person is saying. You can write it. Then you can write your notes like 7 steps formula about it, like what exactly points you need to use. You will write that. And after that, every time that patient comes, you need only 10 minutes, like where exactly you need to apply points. Okay, it is that much easy. So, first thing, you do not need to apply more time or you need to invest more time on a patient. Second thing, if whenever you are calling a patient after a week, okay, like in auricular therapy, we mostly say like call a patient after a week. So what will happen, it will be cost efficient for them too, okay, for the patient too. So what they will think, I need to come only 4 times in a month. Okay, so like if I am asking them money is like around 200 rupees or 300 rupees a session. Okay, so they will think better than going to any other therapist who is charging 200, 300 for a day. I need to only invest 200 in a week. So it will be cost efficient for me. Secondly, it is giving me faster result than any other therapy. So they will also they will also send another patient if they have got result. They will say to their friends, family, and every other person like, yeah, I have got result from over here. You can also go. Okay, you can also go. As I said, okay, the trigger finger person. Okay, she after that every other day or every 10 days she used to bring another person like, ma'am, I have this friend, this she has this problem, can I bring her? I'm like, okay, please bring her. My patients are growing only. Then after some days she was like, I have one more of my friend is asking. So I had more like 5 to 6 more persons like 5 to 6 more patient because of her. More, I guess more than that only. One of her patient, like I am in Mumbai, right? My work is situated nearby Mumbai. Okay, so one of her friend or one of my patient, she had like she was on a vacation or some like a month on a hold in Mumbai. Okay, she was basically from Ahmedabad and she had come over here for a month stay. So she also brought her. Ki, ma'am, see, please check her. She is having also issues. She will also get cure in a month. Please, ma'am, please. I was like, fine, why not? So I had cured many people with auricular therapy. I have many kind of different experiences with. I'll definitely try to contact that person and to tell them that please share your feedbacks with us. Please make videos and feedback so that I can share with them. Okay. So we are bringing auricular therapy. We are bringing diploma in auricular therapy, which is government certified diploma in auricular therapy. If you want to join it, if you want to participate in it, then it is actually launching on
25th of October.
that is next to next Wednesday. And first 15 students starting from today, those who pre-order it, okay, first 15 students, those who pre-order it, they will have a chance or they will get a discount of 1,500 rupees. The actual price of the diploma is 8,000 rupees, but in discount it will be 5,500, and more discount to our subscribers for first 15 students will be 4,000 rupees only. So if you want to join it, you can just WhatsApp us and get to know about it more. Secondly, if you want to complete your master diploma in auricular therapy, that is in this auricular therapy, we will be having 3 steps, 1, 2, and 3. That is now, right now, we are discussing about the diploma in auricular therapy level 1. Second will be advanced diploma in auricular therapy, and the third one will be master diploma, in which you will learn how to make 7-step protocol in auricular therapy, okay, in which you will learn about that. So if you want to like pre-order all the 3 levels right now only, there is a major discount going on for that. Okay, if you want to do that, if you want to know about it, then you can WhatsApp us for that also. We'll let you know about that prices also. If you want to join that, you can definitely join about it. And from today onwards, I'll definitely try to share with you all different auricular points, small auricular points, so that you can also get to get idea what exactly, like how we can treat a person with the help of auricular therapy. This auricular therapy diploma will be in English as well as in Hindi language. Okay, and it is a lifetime access diploma. Like you can join today, and there will be no limit. Like when I can give the exam. Like you have to give a small, short, very easy exam for it. Okay, for all type of diplomas, if you are doing from our academy like institute, then you need to give a small, a very small exam. Okay, like to exactly let us know exact I have studied it. Okay, so you need to give that exam, and there will be no limit, like no time period, like you need to give this exam in this 6 months only, in this 1 year only, in this 2 years only. No, if you are doing it today and if you also come after 5 years, no, I want to give the exam and I want to get the certificate, I will be okay with that also. So you are having your own time, learn it in your own pace. Okay, there will be no hurry of anything. It's just that you learn and you learn something new and you just stay good. You start treating people. If you are a therapist, you should definitely learn auricular therapy. You should definitely learn. Okay, it is a lifetime access, so that you won't forget any point. You can go again and again and revise your points again, learn about them again. Okay, and as this is a government certified diploma, as it is certified by Niti Aayog, so do not worry, this certificate will work all over the world. Okay, this is certified by government of India, so this certificate will work all over the world. So if you are anywhere, you are around anywhere in the world, you can definitely learn this therapy. If you want to know about it, please do WhatsApp us. That's all for today. Thank you so much, everyone.